Anyone know anything about somatization? Okay, so somatization disorder, this topic I have not discussed before.
No, ma'am.
Okay,
Ma'am.
so somatization disorder basically multiple somatic symptoms in the absence of any physical disorder. Okay, so I think you will get some kind of patient in psychiatric OPD na. It is full with this somatic problem only, somatization disorder only. Maximum patient you will get somatization disorder. So some patient are like that. They used to have, they will complain so many physical complaint. They will tell you, like headache, then backache, pain, wherever they, whatever problem means maximum somatic physical problem they will tell you. Then when you will assess actually na, or if you do all the test screening everything you will do, then you will not get any organic or any reason for having this problem. Means they used to have that feeling that they will having these things or this kind of problem, so they will having, they will complain various this one physical complaint they will have without any actual reason. So the symptoms are recurrent and chronic, and at least 2 years of duration is needful for diagnosis. So it is very the episode is chronic, and it is, and we have for diagnosis at least 2 years duration is needed. Then symptoms are vague, then presented in a dramatic manner and involve multiple organ system. So they will multiple organ problem they will complain. The common symptoms include gastrointestinal problem like abdominal pain, then nausea, vomiting, abnormal skin sensation, sexual or menstrual complaint. So so many in every organ they used to having that problem. And most important thing is that for somatization disorder, somatoform disorder, you patient will say only like I have pain, like that they will start. Then after that, if you say that you have this problem, if you have this problem, fever also there, like that, whatever problem you will say, that thing they will means ready to have the yes, I have this problem, this whatever you say. Means you can in your shift complain whatever you want. If you write that thing, if you ask patient, they will say yes only. And actually if you assess, then there is no any reason or nothing, you will not get any actual reason. So it is basically some somatic complaint which patient used to show. Then next, see what are the other thing. Then there is a frequent change of treating physician. So you will get this kind of patient in your family members or in your neighbor also. You will see some person like this. So they used to frequently change this physician. Means it is called as one term. Another term is called as doctor shopping. Means they will go to one doctor, then doctor when, because if we assess properly, then test and everything we will do, then after that we will find that nothing is there, or physician find that no problem is there. Then obviously physician will not give any medication, then they will this one some counseling or like that they will give. Then after that also what happened, they are having that okay, he didn't give any medication this for this problem, he didn't give any medication, then they will go to another doctor. So like that frequently they are changing the physician or doctor. So this is called doctor shopping. So in somatoform disorder, this symptom is very frequent. So if you get this kind of patient, you will get so many prescription and so many testing, this one investigation form and all, you will get so many. And if slight little bit the abnormality, like which is we, you can ignore that thing also. If they find all that thing also, for that also they are demanding medication, or they will need some treatment for that also. So it is basically they want some medicine, or they want because of that somatic complaint, and they get some attention. So it is basically related to some attention. Then persistent refusal to accept the advice or reassurance from several doctors that there is no any physical explanation for the symptoms. So they will refuse. If you give some advice or reassurance also, they will not able to accept that thing, and they are having preoccupation, preoccupied with their mind that I am having this problem, and for that problem I need medication. So like that they used to have thinking. Then some degree of impairment of social and family functioning attribute to the nature of symptoms and resulting behavior. So obviously if frequent means somatic complaint they will having, and because of that their daily activities or social functioning, family functioning will be impaired. Then presence of conversion symptoms is common. So in dissociative, I am explaining about this conversion, is not it? You have understood this one, dissociative seizure or true seizure, false seizure, I have discussed now. So like that, this is also called conversion. So for that, this kind of whatever symptoms they have, they are showing this kind of symptoms. Understood somatoform disorder till now? Anything, any doubt? So among you, anyone have this kind of problem? Those who is to do frequent means doctor shopping, na? What I am telling. Anyone have? They are not satisfied with any one doctor. They used to go or change frequent means other doctor, and they will examine means investigation they will do. Then medication also they will change. Okay, so actually you will get in psychiatric OPD na maximum patient will like that only. You will get psychotic patient also you will get, but somatic somatoform disorder na maximum patient they have. Then next see what are the main treatment. Okay, so the treatment of psychosis usually is first one is supportive psychotherapy. So counseling and all whatever we can do, that thing we can give. So first one is we have to make or establish rapport. Then after that only we will do the treatment part, means counseling and all we can give. Then behavior modification. So because of that behavior problem is there, because of that only patient will having showing this problem. So that's why we have to do the behavior modification. And under behavior modification, reinforcement or positive reinforcement is very much important. Then only patient will avoid or doing that kind of behavior if positive reinforcement is there. Then relaxation therapy, all of you know about relaxation therapy. Can anyone tell me any relaxation therapy? What type of relaxation therapies are there? Means what are the relaxation therapy? You know? Relaxation therapy, what? Anyone know? Any relaxation therapy? You are sleeping or what?
No, ma'am.
Okay. So relaxation therapy means what? Like so many relaxation therapies are there. Deep breathing exercises,
Deep breathing, yoga.
yoga, and meditation, music therapy, pet therapy. Is not it? Various distraction therapies are there. So these things we can give. Okay, so this is basically about main treatment on is this one. This relaxation therapy is very much important. Okay, so whatever symptoms na you have, whatever symptoms you have seen or we have discussed till now, so I can give you like example, and it is me. So 2 years back I have this kind of symptoms, means I used to have if some small any small problem I have now, I used to have that thing that I might have this very big disease now. I used to read in books, and after that I am thinking that I am having this kind of problem. Then I am doing I think almost 10,000 tests. I did investigation, everything I did. Then later on I find that I don't have any this kind of problem. Then doctor gave me some anxiety medication. Then after that I took medication for 1 week. Then after that, one day I checked this medication list. Then I came to know that, oh, these are some anxiety medication or benzodiazepines they are giving me. Then after that, one my brother is also a doctor. Then I talk with him. Then he suggests me that you did some relaxation therapy. Then I did this maximum time. I'm this one doing this music therapy. Na? It is very helpful. If you are having any kind of like depression or any problem, na music is the best solution. So during that time I did this, then without medication I overcome these things. Then after that till now I didn't take any kind of, I used to have sometimes whenever I am having any problem, I used to have that feeling, but I try to avoid that thing, and till now without medication I am doing okay. Okay, so always at least we have this kind of things. If you uh, check yourself also, na somatic problem, na maximum time we used to having that problem, means we used to have, and sometimes patient or someone will, if we have that kind of capacity to control that thing, then we can overcome, and if we don't have that thing, then we are having this problem for longer time. Okay, so this is about uh, somatoform disorder. Basically this relaxation therapy is very much important. Then drug therapy, so antidepressant, then benzodiazepine. Antidepressant, you know, because patient used to having that feeling that I'm having some problem or disorder I'm having, so because of that depression may be there. So that's why antidepressant are given. Then benzodiazepines, you know, to reduce the anxiety, because we are having that anxiety symptoms, panic attack or breathlessness or shortness of breath, having this problem. So that's why this benzodiazepines is very much important. So this treatment part, I think in your book it's not there. I think you check once in R. it's not there. So this treatment part I took from some other book. So that's why if you want to do screenshot, then you can take. So this under organic brain disorder, na, this is only for this one. Short notes only it's used to came. So that's why I'm not giving, means very long this one management I'm not giving. So this small thing you can, from your side you can write, if you want relaxation therapy, under relaxation therapy what are the things, if you want to add, then you can add. Okay, but short notes like this one, somatoform disorder, short notes, dissociative disorder, it's used to come short notes. Then, okay, we will see hypochondriasis. So hypochondriasis is nothing but it is the severe form of somatoform disorder. Okay, then we see what is hypochondriasis. So it is defined as persistent preoccupation with a fear of having one or serious disease based on person's own interpretation of normal body functioning or a minor physical abnormalities. So that is about hypochondriasis. What I am saying na, means if person is having any simple problem or any problem, na, they incorporate with some big disorder, then they are having preoccupation, means they are preoccupied with that I am having this problem, or I might be died with this problem, like that they are having that fear. Okay, then some problem or something it's happened in their normal body, then abnormalities they try to find out, and they are thinking that I cancer or like that big disorder they used to compare with that. So this is basically hypochondriacal or hypochondriasis disorder. Complete physical examination. So what are the main features? Examination and investigation do not show presence of any significant abnormality. If you assess complete physical examination and investigation, you will not get any abnormalities. Then the fear or belief persists despite of assurance to the contrary by showing normal reports to the patient. So if you show normal reports also, then also they are not sure, means they will not believe that thing. Then fear of or belief is not a delusion, but it is instead an example of overvalued ideas. So patient may agree regarding the possibility of his exaggeration of the situation at that time. So it is not delusion. It is they are having some preoccupation and overvalued ideas. So 4 point number 4 you check, that is whatever it is in somatoform disorder, means frequent changing of physician. So this is also very much important. Always remember, in hypochondriasis or somatoform disorder, try to mention that thing. That is doctor shopping, or they used to change the physician very frequently, or they will do frequent investigation. Then for this, what are the main nursing diagnosis? So this diagnosis in your book, it's not there. So all of you take the screenshot, and if short notes came, at least in nursing management, you should write 2 diagnoses or 3 diagnoses now, then also you will get marks. Okay, so in short notes now, long question 2, you have to write at least 4 or 5 nursing diagnoses, is not it? So overall management you can write. Then if in short notes came na any disorder if short notes came, always try to write nursing management with 2 or 3 diagnoses at least. If you don't know about the main this one etiology, at least any disorder came, at least you know the symptoms. Depending on the symptoms, if you write the treatment part to management part, I think in psychiatry you will now all of you understand that what are the medication they will give. Anti-anxiety, anti-depression, antipsychotic, this thing also they will give, is not it? Then if you nursing management, if you write 2 diagnoses also, na, then also you will get marks. So if you don't know anything, at least definition you write, 2 3 symptoms you write, and try to write the treatment part. Then also you will get some marks. Okay. So let's see what are the main diagnoses. So chronic pain related to repressed anxiety and learned maladaptive behavior. So this is basically whatever patient used to show that symptoms the patient used to complain. This is basically maladaptive behavior. So it is what first diagnosis is chronic pain related to repressed anxiety and learned maladaptive coping skill as evidenced by verbal complaints of pain and excessive use of analgesic. Okay, so whatever diagnosis I have given you, na, if patient is having pain, you have to write for this somatoform and this one, na, you have to write like this. You can write chronic pain related to like whatever normal diagnosis you used to write. Don't write like this. It is because of that maladaptive coping skill. So that's why this disorder or these symptoms are there. Then self-care deficit related to loss or alteration of physical functioning as evidenced by need for assistance to carry out self-care activities such as eating, dressing. So this is also another nursing diagnosis. Okay, then fear related to past experience with life-threatening illness. So patient, I am telling you that patient will having preoccupation with that I am having this life-threatening disease, cancer, AIDS, like that they used to complain. Then next one is ineffective coping related to repressed anxiety and unmet dependency needs as evidenced by verbalization of numerous physical complaints. So this nursing diagnosis, na, try to remember it, all this nursing diagnosis. Then knowledge deficit related to strong denial defense system as evidenced by history of doctor shopping for evidence of organic pathology to substantiate physical complaints. So knowledge deficit will be there because of this one denial defense system. So patient used to deny. So that's why knowledge deficit will, if you teach them, then they will not able to listen. So that's why these are the basic nursing diagnosis. At least 2 or 3 try to remember, and if short notes came, try to write all these 3 diagnoses. Okay? Understood?
Man, understood, ma'am.
Okay. So this is about somatoform disorder. I think under organic in this one, neurotic and stress related disorder, I think all this disorder is finished, I think, isn't it? Other disorder is there, na? These are two very short. So I'll not discuss all these things. If you will not understand this under other disorder, na, some I forgot what are the main disorder. Some disorder there, and I think 2 3 lines they are giving in your book. So if you try to read all these things, if you will not understand anything, then let me know, then only I will discuss. Okay, so I think under neurotic and stress I have covered all the disorder, is not it? You check once in your book. PTSD I did, adjustment I did, then dissociative, somatoform hypochondriasis, then phobia, anxiety, these things too. On all of you have given this one presentation only, isn't it?
Yes, ma'am.
Done na? So let's see tomorrow what we will discuss. I think personality disorder is there in your syllabus. So I think we'll discuss the personality disorder. Okay. So under personality disorder, so many types are there. So it will take time. So we'll discuss about personality disorder. Okay. Then CR, you send me this one attendance. Okay.
Yes, ma'am.
Okay.
Ma'am.
Anything you have not understood or anything you want to ask about this one? Neurotic and stress related. All of you read this neurotic and stress related na, under neurotic and stress related, whatever disorder we have discussed, all of you read once. I think tomorrow, if possible, I'll do some this one discussion type of viva like that we'll do. Okay. Then we'll start this one personality disorder. Okay. Then from tomorrow or day after tomorrow, if you have any free class na, if no one is taking any class, please inform me. Okay, then I'll take. If I am free na during that time, I'm try to take. Okay, so yeah, you inform me if any free classes there. Then you inform me.
Yes, ma'am.
Okay, okay. Thank you.
Okay, ma'am. Thank you, ma'am.
Thank you, ma'am.